Now, as South Africa grapples with the second wave of COVID-19's pandemic, the Human Sciences Research Council is conducting antibody tests to determine how COVID-19 continues to spread through communities with a nationwide antibody testing survey. The antibody survey will provide an opportunity for researchers to better understand and generate a national estimate of what proportion of South Africans have been infected with the virus, but also get to those who may have been infected without even knowing. Now, for more on this, we are joined by Dr. Sizulu Moyo from the Human Sciences Research Council. Doctor, good afternoon. Thank you indeed for joining us. Maybe let's start right there. You say you're conducting research. You've drawn blood. I did some research. I looked around. Over 19,000 samples of blood were taken by the HSRC. Tell us a bit more about what you plan to do with that.
Good evening, and thank you very much for the opportunity to talk about this survey. We have just started the survey. We started at the beginning of November. Our aim is to interview 19,000 people and to collect blood samples from those 19,000 people. We are not there yet. As I've said, we're about week 4 now, and we are in the process of collecting the samples. Once the samples are collected, they are tested to determine if for the presence of antibodies, so that we can know who has been infected from the sample of people who participate in the survey. We are conducting this survey in 2 waves. The first wave, as I said, went into the field at the beginning of November. We want it to be for 6 to 8 weeks. Given everything that is happening within this pandemic, we project that it will take us 8 weeks to complete it. We aim to have this wave 1 finished at the end of this month, at the end of December. And then we will begin with wave 2, which will be similar to wave 1 at the beginning of January 2021. In both cases, we will be collecting blood samples and we will be testing them to determine the presence of antibodies, so that we may know who may have been infected with COVID-19. And as you rightly said, this will give us a picture of the infection in the country. We know that there are various studies on COVID-19 that are taking place, but ours is one of those ones that are looking at infections across the country in what we may call a representative survey in South Africa, in the way in which we select and determine where we go and how we choose people randomly to participate, so that we can get a picture as to what is happening in South Africa.
Along with blood samples, field workers, I understand, will gather data from 20-minute interviews to assess the history of infection. All of this goes a long way in what you guys at the HSRC do, getting data, putting it together and charting a way forward. How are you helping with the fight of COVID-19 as it stands in South Africa?
Well, I think this, as you may know, that many countries have done this type of surveys. And we know that the numbers, for example, that are reported by the Department of Health, the statistics, only refer to those people who go to test. And we know that this infection, some people are completely asymptomatic. They may not go and test. However, we know that people who are infected, who are asymptomatic or who have mild symptoms, are also infectious. Therefore, this whole approach around how we prevent spread of infections, the wearing of masks, the sanitization of our hands, cleaning of surfaces, and the physical distancing. So when we collect this information, we can get a clear picture as to how many people are infected in the country, and it will help us to maybe push forward the message around the non-pharmaceutical measures for preventing COVID-19. I think it has been said that, our behaviors, which is one of the things that is included in our survey. So the 20-minute interviews really ask people around symptoms. They also ask around how they are practicing these preventive measures that have been put forward in the country. So we'll be able to gauge and see how far that is going, and we'll be able to link that with the antibody testing that will be done in the laboratory. In addition, to this, we are also conducting other further detailed tests that look at how the body responds to COVID-19 infection. So in this way, we're working together. Obviously, the HSRC is not working alone. We're working with other institutions like the NICD, which is obviously a key institution in this at this time. So we're working with them and NHLS and SAMRC in order to further understand what may be happening within the body and to feed into the information that is required to help the country address and move forward in dealing with the epidemic.
The one question, our time has run up, Doctor, but I have to ask this question. A lot of people would say, I mean, we've heard of people saying I was asymptomatic, I did not show any physical signs or did not, was very sick. Young people in particular, we know that right now we're in the pandemic where 17 to 19-year-olds are said to be mostly being infected with COVID-19. And then there's a question about the antibodies, and if you've got them in your body, how long do they stay in your body for you to feel, look, I'm fine, I'm safe, I will no longer get the virus? Because that is the perception that some people have, is that once you've got it, you will not get it.
I think that is the question that scientists are grappling with. We know that in quite a number of diseases, you can get immunity. However, for COVID-19, there have been different data from various places that have given different indications of how long the antibodies last in the body. At the moment, there is no definitive answer, and therefore we are all at risk. We need to remain vigilant. We need to adhere to the measures that have been put forward to help us to prevent contracting COVID-19. This is something that is still being studied by various scientists across the world. So there is no definitive answer at this moment, and we need to work within what we have, which is let's do everything that we can to prevent contracting the virus and also spreading it to others in the event that we get infected.
Dr. Sizulu Moyo, Human Sciences Research Council, thank you indeed for joining us, ma'am.
Thank you very much for the opportunity.